how are you? My name's Courtney. I'm going to be your student nurse today. May I have your name and date of birth, please? So I verify the name and date of birth on the wristband. So the provider has put it in order for you to get labetalol today. So essentially what labetalol is it's a beta blocker. So what it does is it decreases your cardiac load and it also lowers your blood pressure. Before we administer that, I'd like to ask if you have any allergies to any medications. They let me know. If the patient does have allergies, I compare it on the wristband and find out what the reaction is to that allergen. I'd also ask if the patient was diabetic. I'm doing hand hygiene. Okay, so again, before we administer that medication, to make sure that I'm able to give it, we check the vital signs. Specifically, we check the blood pressure. We make sure that the blood pressure is not too low, as a side effect could cause hypotension. We'd also like to make sure that the pulse isn't too low. If the pulse was below 50, we would hold the medication and we'd reach out to a provider to figure out what steps they'd like us to take next. Go ahead and put some gloves on. So ma'am, some potential side effects of this medication is orthostatic hypotension. So what that does is it lowers your blood pressure. If you were to suddenly stand up or make rapid movements very quickly, some symptoms of that would be like dizziness or slight confusion. The medication can also cause nausea. So due to that risk for orthostatic hypotension, we'd like to ask that you get up slowly and that you don't make any quick or rapid movements, okay? So, with my medication, it is labetalol. What was ordered was 20 milligrams IV push. What the vial was given was 5 milligrams. So when I do my calculations, I would give the patient 4 milliliters to make sure that I'm doing that properly. So I've done my 6 routes. My 6 rights. I've made sure that I have the right patient by verifying on the wristband, comparing the MAR to make sure I have the right medication, checking the MAR again to make sure I have the right route, which is going to be IV push, the right dose, which is going to be that 4 milliliters to equate to that 20 milligrams, the right time. I've made sure that this was the appropriate time to give the medication, and then I'll make sure I properly document it afterwards. So prior to giving that medication, I would unclamp, and I'm going to scrub the hub, and then I would get a new saline flush. We're going to aspirate, make sure that we have blood return, and we do. So then I would push 3 to 5 milliliters of the saline in, and I'm also making sure that the patient isn't experiencing any pain or discomfort and that I don't see any edema. So that's done. We throw that in the trash can. I get a new white alcohol pad. I scrub the hub again. And so then I go to administer the medication, which is going to be that 4 milliliters of labetalol. This medication is supposed to be pushed over 2 minutes. So I would push over 2 minutes. I wouldn't push too rapidly. I wouldn't push too slowly. I'd ask the patient, make sure that you're not in any pain, that I'm not seeing any signs of infiltration, and that I don't see any edema. So it's been 2 minutes on that. We have a new alcohol pad that I'm cleaning off. So I scrub the hub one more time. New saline flush. Put that back on, and then I push another 3 to 5 milliliters of the saline. Just clean that line. Okay, these are going in the trash, so then I clamp this back once it's done. So once that medication has been administered, what I would do is I would check the blood pressure again. I should see a decrease. That's how I know that the medication has worked. I would see a decrease in the blood pressure. As far as this medication, there were no compatibility issues that I saw when I looked at the Orange Pharmacology book. But the blood pressure has been checked again to make sure that the therapeutic effect has been is reflecting. And also, I reiterate to the patient not to get up too quickly because there's that risk for the orthostatic hypotension. We wouldn't want you to experience any of that. And that is it.